This is Plant-Based Briefing. Doctors don't learn nutrition in med school. Here's how that affects you, by Lucy Danziger at thebeet.com. And I'm Marian Erickson, host of this 10-minute curated content plant-based podcast, where I narrate a variety of articles on plant-based, compassionate, and eco-friendly living with permission every weekday. And today's article is from thebeet.com. They're a plant-based media platform offering an amazing variety of information on food, health news, product lunches, reviews, expert advice. I highly recommend following them on social media and even subscribing to their newsletter. So now let's get to today's plant-based briefing. Doctors don't learn nutrition in med school. Here's how that affects you, by Lucy Danziger at thebeet.com. Doctors are taught an average of 1% of their total lecture time in medical school learning about nutrition, and now one doctor, Dr. Michael Greger, is out to change that by encouraging students to enroll in an extra outside course in nutrition. The average time spent learning about food as medicine falls far short of the National Research Council's recommendation for a baseline nutrition curriculum, according to a new report published by the Harvard Food and Law Policy Clinic, which has acknowledged, quote, "Nutrition plays a critical role in the prevention and treatment of many chronic diseases, and diet is one of the most significant risk factors for disability and premature death in the United States," unquote. Neither the federal government, which helps fund medical schools, nor accreditation organizations, which validates them, enforce any minimum level of diet instruction. So Greger decided to do something about it by launching a course to teach med students how to talk to patients about the importance of nutrition in disease prevention and cure. Given to students in Germany, the 11-part nutrition course, which Dr. Michael Greger is an advisor to, is called the Physicians Association for Nutrition, or PAN International. The purpose of PAN is to teach medical students nutrition and increase awareness in the medical community of the power of plant-based nutrition for treating and preventing diseases like heart disease and diabetes. Taking place in Munich, the online course has more than 2,700 medical students signing up for the 11-part series so far. The organizers are hoping to expand it to the rest of the world. The first time the course was offered, nearly 2,500 people attended, mostly medical students from Germany. The event's medical director, Nicholas Oppenreiter, MD, says, "This record number of attendees shows us that nutrition and nutritional medicine need to be a much more central part of medical education and healthcare. That's what we are working for at PAN." The 11-part Iss Da, or Eat That, series has been organized almost exclusively by volunteers from PAN University groups and brings together renowned experts from diverse specialties of medicine and nutritional science. The online talks took place between November 2020 and January 2021, covering topics such as nutritional medicine and cardiology, food and the climate crisis, and gastroenterology and the microbiome. A patient who presents with heart disease, type 2 diabetes, or even some forms of cancer such as colon or hormonally linked cancers such as breast and prostate are likely to never hear a word about how changing their diet can help them get healthier, along with taking vital life-saving medicine, according to research. As prevention and intervention, doctors like Dr. Caldwell Esselstyn have used dietary changes to help treat patients facing heart surgery to the point where signs of the disease have been reversed by adopting a whole foods plant-based diet. How does this affect you? The next time a doctor tells you that you need to go on medication, ask about nutrition. No one is suggesting we turn our backs on science, medicine, and life-saving drugs or medical progress, but, quote-unquote, "let food be thy medicine," is as old as the Hippocratic Oath. Food should be a tool in the kit of all doctors facing lifestyle-related diseases such as obesity, diabetes, heart disease, and chronic inflammation. Studies have shown a whole food plant-based diet low in oil can reverse symptoms of heart disease. Ask your doctor if this is an option for you. You just listened to Doctors Don't Learn Nutrition in Med School. Here's how that affects you, by Lucy Danziger at thebeet.com. And I'm your host, Marian Erickson, and this is Plant-Based Briefing. I am so grateful there are people like Dr. Greger, Dr. Michael Clapper, Dr. Barnard at PCRM, who are working to help medical school students get trained on nutrition. But there's still a huge gap there, so if you do ask your doctor about nutrition, and they don't know about whole foods plant-based diets, don't be surprised. You might want to look into a plant-based doctor or dietitian or lifestyle medicine practitioner. And if you're not fortunate enough to have any of these plant-based professionals in your area, Telehealth or telemedicine may be an option for you to get the support and information you need. Physicians Committee for Responsible Medicine has a feature on their website called Find a Doctor, and you can search for plant-based physicians by location as well as telehealth providers. You can find that at pcrm.org/findadoctor, and I'll put a link to that in the show notes as well. And tune in tomorrow for an article specifically about lifestyle medicine. And please share this episode with anyone who might benefit, and thanks for listening.